So could you briefly introduce yourself and describe your path to becoming an audiologist?
Sure. My name is Jane Brady. I'm a doctor of audiology. I've been practicing about 33 years. I have an undergraduate degree in audiology, a master's degree in audiology, and a doctor of audiology degree, which I received from the Pennsylvania College of Optometry, which is now Salus University, which I think was just absorbed by Drexel. So the doctorate of audiology is not a medical degree, it's a clinical degree, like a psychology degree. So we do not prescribe medicine. We do not operate. We do not treat disease. We treat hearing loss and the associated issues that are associated with hearing loss.
So you send patients to other places to get medications?
Mm-hmm. So if people have issues where they're dizzy, or we feel like they need medical treatment for an ear infection, disease of the ear, impacted wax of the ear, we send those to our referral sources like primary care doctors or their ENTs, their ear specialists.
Okay. So what does a typical day look like for you now?
So there really is no typical day. We see adult patients. We don't see pediatrics here. So it could involve diagnosing and treating someone who is having troubles with family relationships because they can't hear. There are more subtle types of hearing losses. So we could be seeing patients who have issues with their hearing aid performance. The nice thing about audiology, it's a little technical. There's a lot of equipment involved, a lot of computers involved, and there's a lot of even psychology, counseling involved. So we work with, it's a kind of a combination of a lot of different specialties, which I like about it. There are people that live alone that don't communicate a lot, but they may have family, friends visiting on a weekend, so they may not even notice a hearing loss exists until a family comes over and the television's really loud. Mm-hmm. But we know there are a lot of associated issues related with untreated hearing loss, like cognitive decline. Mm-hmm. People with diabetes can have associated hearing loss. People with cardiovascular disease, people who've had a history of cancer, and through some of the treatments like chemotherapy, those medicines that you need to take to maybe be life-saving are very ototoxic. That could affect hearing. So this type of field, we really do co-manage care with a lot of different specialists, which has been very rewarding. It's very much not about a hearing aid as it is about hearing treatment, hearing loss treatment, and how we can best use devices, use listening therapy to help improve someone's lifestyle. So really every day is kind of different. Sometimes it's full of testing in a test booth. We do cognitive screenings. We test in quiet, we test in noise to really see if we can pinpoint if one ear is worse than the other. Asymmetry could be a sign of a medical condition, but it could be testing, could be diagnostics, could be a lot of hearing aid deliveries and treatment with more equipment. That's the fun part. It is, you can really use a lot of different skills to succeed in this field.
Are there any career paths that you can take within audiology?
Well, you could be a diagnostician. I'm a business owner and an audiologist. You can be in research. You can work in the academic field. You can teach. You can be in sales, selling audiology equipment, some of the equipment we use for identification or diagnostics, as well as some of the equipment we use to fit with hearing loss. There are people that are equipment specialists. There are people who are audiologists that have developed management software programs. So there are not just treatment options where I'm at a desk and a patient is in front of me.
Did you explore any of those throughout your journey?
I've done a lot of different things. I worked in a hospital in the Neuroscience Institute up in at JFK Medical Center in Edison, and there I worked with a lot of dizzy patients who were having balance issues. Worked with the rehab department there. I have worked in medical ENT, so working with physicians in the operating rooms, helping ENTs, do some of the procedures they need to do. I like this. It's a little bit more lifestyle-wise, a little bit better hours. We're not in emergency rooms. We're not seeing patients after hours. So that was a nice work-life balance, where early in my career it was a little bit more unsettled. I reach out through alumni in the classroom at Penn State University, and I'm in the classroom because some of my colleagues were former classmates, and I'll go in and teach lessons and lecture on some topics that they may be introducing, and I like that too. Yeah.
Now moving on to more like auditory health, what are the biggest risk factors for hearing loss, and have you seen any habits in patients that can like really damage your hearing?
So risk factors, there's a lot. There is diabetes, there's cardiovascular disease, kidney disease, poor cardiac health, poor exercise, poor wellness habits. Noise exposure is a big one. All those things can affect your hearing. People with hearing loss can have tinnitus, which is a physical sensation of sound that other people may not hear, but it's present in the person who's listening and has it and suffers from it. People could have balance issues. And with hearing loss, we know certain medications to treat conditions can help you get better, but may be damaging to the ear because they're so strong. So if you're a chemotherapeutic patient, we use ototoxic monitoring to test pre-chemo, during intervals of chemotherapy, and post, because we don't want to have a subsequent hearing loss or change in hearing that's unidentified, because with untreated hearing loss, we know people can be get depressed, they can be more annoyed, they could be more frustrated, they could be more introverted, they could be socially less active, and then that delves into all the psychological effects of untreated hearing loss. So it's really important to get hearing assessments as early as age 50 with no pre-existing conditions, so we can monitor, get a baseline, because subtle hearing loss that's untreated can cause cognitive decline later in life. It can cause interpersonal issues with friends and family and coworkers. So while we know you should get your blood work done maybe on a yearly basis, get your teeth cleaned twice a year by a dentist, it's important to get your hearing screened at least annually after you turn 50, and then maybe annually or biannually after that.
Okay. What's the impact of AirPods?
So the use of AirPods brings sound very close to your eardrum. And because they're not a custom fit, they can allow a lot of background noise in. So in a situation where maybe you're studying in the cafeteria, and the cafeteria can be pretty loud, if you're trying to listen to something through the AirPods, it may not be as audible, so you turn it up. You can't hear it, doesn't mean there's not sound pressure coming out and hitting that drum and introducing more noise to the auditory nerve, which can damage hearing. So with a more custom type of listening system or a custom mold on an AirPod, you're blocking out background noise so you can listen to safer levels. The other issue is sometimes use overnight can cause the ear to get fatigued, which if you fall asleep with it on loud, it's a longer period of time that your ear is exposed to a lot of noise, which could over time cause long-term damage. We know 85 decibels of sound is safe. You can listen to that all day long, but every 5 decibels up you go in volume, you're cutting your safe exposure time in half. So when you're up to 95 decibels, you really can only listen safely for 2 hours. And if you're at a concert somewhere, you may be up in an environment that you're at 100, 105 decibels, where really just an hour is safe, but that type of event can be much longer. And that can cause either temporary or permanent threshold shift, and you kind of can't get that back. Some people leave a really loud wedding or a party with numb ears, ringing in the ears. It almost seems dull, and hopefully that bounces back, but that type of repeated exposure over time will permanently damage the ear.
Are there any ways to prevent it besides just avoiding that? Like, are there any medications or anything?
Medications, no. Hearing protection is a great source of prevention. And I think getting into good habits, probably when people are young, if they're exposed to the lawnmower or the snowblower or concerts with music, we really recommend some type of custom hearing protection that by molding to the shape of the ear and by being inserted deeper into the ear according to the shape of the canal, we're able to really provide a deadening effect and a more effective noise reduction. And for musicians, or if you were a music goer, these custom protections could have filters in them to have a flat deadening response. So that's been a nice, you asked earlier about what types of careers are there. There's a lot of audiologists work in Nashville working with performers making custom hearing protection.
Oh, cool.
You can work in NASCAR. We've made a lot of headsets for race car drivers in their car, custom protection with drivers that plug into their team at their base. So those types of things, it's kind of a different pathway, but that's specifically for hearing protection. And it's a way to preserve the listening experience in different environments when it's not quiet, which is ideal.
Okay. What role do nutrition and stress play on auditory health?
Well, I think like anything, the more tired you are, the less you're able to concentrate and pay attention. We know high diet of sugar can affect your ear, because the ear being very vascularized, there are changes in the blood that can cause something like diabetes to affect hearing. We know if there's cardiovascular disease, your arteries that are running through the neck up to the ear can be affected due to plaques or blockages, and that could affect hearing. Just had a patient earlier today who we noticed a change in only one of her ears, and you have to start to wonder what would cause a change in one ear versus the other if it's not noise, not trauma. And she's seeing a cardiologist for some issues, and we'll co-manage that case to have them check blood pathways through that area up to that ear to see if there are any blockages or plaques. So a good diet, a good healthy diet is important. We know, again, with diabetes, you're 20% more likely to get hearing loss, and if you're pre-diabetic, you're 3 times more likely to develop hearing loss. But again, when we think of good heart health, we think of things like excessive alcohol that can cause tinnitus, which can be a very abrasive sound in the ear, which can lead to fatigue, irritation, anger, and a lot of frustration. It also can interfere with the speech signal if that noise is so loud.
Wow. So throughout your journey, what are some skills that you find are most essential and valuable in your career today?
I think interpersonal skills are very important. I'm not sitting at a desk, I'm interacting with people all day long. The ability to empathize with who's sitting in the chair in front of me, and to recognize when a significant other comes with a client, that the client may have a hearing loss, but the significant other has to deal with it. A lot of people have grandparents with hearing loss, and it can be very isolating. People may be mismanaged or poorly managed for types of cognitive issues when there could be an underlying hearing loss, which needs to be addressed. You have to be confident. You always have to be willing to learn. 1, for continuing education is always important, but 2, to kind of stay on top of your field. There's ever-changing products and processes, and people who are not comfortable with social media kind of have a more difficult time in this field, because it's so important for feedback. You have to be able to take good feedback, you have to be able to take bad feedback, and kind of use it to grow. You have to be able to be confident in the work you do, because hearing loss is a little different than like an optometrist fitting glasses. When you lose your hearing, you lose it in loudness, but you also lose it in clarity. Optometry, putting lenses on an eye, that kind of, as soon as you get the vision correction, you're able to correct the vision loss. But with hearing devices, you can correct the volume, but we can't grow back hair cells to make all the clarity 100% perfect all the time. So people will always hear better in a quiet environment. In noise, just like people with normal hearing, the background really can interfere with soft sounds of speech. So if people have a dialect or an accent, those things can interfere a hearing in in a normal environment, but you have to know how that process then becomes more complicated in a crowded environment. You have to, again, I said empathy, but you have to be willing to work with a lot of different types of people, because products, you hate to, we're helping people hear better, and I really feel we're changing lives every day. Giving somebody the gift of hearing is such a powerful thing to be able to do, and not everybody can wear the same type of product. Not everybody could wear the best of the best, but you can still help a lot of people by helping them along the journey, because it's a lot of counseling, a lot of cheerleading for them, because when you put devices in the ear, it does take a while for your brain to assimilate to that, so patience is really important too.
What do you find most challenging about your job, and what do you find most rewarding about your job?
Challenging is I wish everybody could get what they want, and I wish I could do it all for free. Not everybody can afford the services that are provided or required. I love helping people hear better, and in my career, I've tried to do that any way I can, with any product I have available, to do something in someone's comfort zone to help them hear better. What's most rewarding is really that gift of hearing, being able to help someone have a better conversation with a sibling or a grandchild, or have them better hear over the phone. We all rely on technology so much. FaceTime, WhatsApp, all those things are bringing people together, even though they're physically not together. And when you use technology appropriately, when you're hearing better, you can have better experiences in those environments. And that's very rewarding. Decades ago, I started practicing in 1990. We didn't have all that technology available, so we were a lot more limited in what devices looked like, were shaped like, but also what they were able to do. Didn't mean you didn't have the passion and the excitement, you were just more limited. So nowadays there's so much available, and technology's growing every day, that the things I'm listening to now, I couldn't have imagined listening to a device that is as clear as what's available now compared to what was available earlier. And things aren't as big anymore, which is great. People don't think of hearing enhancers like they do about glasses or earrings. It's not jewelry. So there's still that negative connotation with having to need something to help you hear better. So I like that devices have other features like Bluetooth compatibility, and some devices don't look like traditional hearing enhancers, so people are more comfortable wearing them. That's nice. And that's exciting. I have a lot more flexibility in that respect.
Are there any specific pieces of ear products that you are really excited about?
Not specifically. I like there's products that are invisible now that we never had invisibility available. There are pretty small products that now have Bluetooth. They can stream, they can not just connect to a phone, they can connect to multiple devices simultaneously. That's exciting. There are devices that have, apps on the phone that now you can use a phone as a remote control, where decades ago that remote had to be worn around the neck or had to be a handheld remote. That's not necessary anymore. It's exciting. Because there's so many options, and we work with so many manufacturers, it's exciting to have so many options to really fine-tune the needs of somebody. You can do color. Devices aren't hair color, they're not skin color. There are all sorts of different colors, and people like to express their individuality by the way the devices look also, and that's exciting. That wasn't always available, when I first started in the field, almost 35 years ago.
So you kind of already mentioned this before, but what do you love about your job, and why would you recommend audiology to a person interested in the healthcare field? What's
nice about this job is, yes, you're in the healthcare field. You're not necessarily have to be in a hospital. You're not necessarily in a physician's office. You're in an environment that's very professional. Some people don't like blood. Some people don't like bodily fluids. And while we've all had our share of anatomy and neuroanatomy classes, that's not typically what this environment is. I mentioned earlier, it is combining counseling. So there's psychology involved. There's computer science involved, there's electronics involved, engineering involved. So it's a field that really does engage a lot of your interests in one field that's still technically a health profession, but you still get to use a lot of technology, which is exciting. We're using technology to help people hear better. And that's nice. I wouldn't want to be sitting in an office all day in front of somebody. I like the diversity of the day. I like being able to work with a new patient and listen to the issues and decide how I'm gonna, work their treatment plan. So there's a level of independence as well that's, different than in a hospital where there's levels of trainees. In general, the field training isn't that long. It's 4 years of college, 4 years afterwards, and then, kind of on the job, on the site training. And those are things that always appeal to me.
That's really nice. Well, thank you so much
You're
for the
welcome.
interview.